The NHS has been on everybody's minds recently, whether that be people on doorsteps banging pots and pans to say thank you for their work during the pandemic, or it be people debating fiercely about whether people in the NHS have the right to strike if their jobs are just too important. I spoke with Niall this week, who was a paramedic for 5 years before he recently transitioned out of the role. Niall told me about some of his personal experiences within the NHS and what it's like to work in one of these challenging and very important roles. We started talking about COVID. Niall had been working in the ambulance service for 2 years when COVID started.
Just the sheer volume at one point, it was, I think some colleagues could agree that it was almost like a cardiac arrest a day, which is quite abnormal. So the demand of that is it can take up to at least 2 ambulances and 1 car just for 1 cardiac arrest. And that job can take anywhere between half an hour, if it's not a good outcome, to up to 2. And when you've got 2 to 3 ambulance resources on 1 job, and then you've got other cardiac arrests and you've got all the other normal jobs, the waiting times at that time were quite staggering. Almost kind of when COVID ended, at least in terms of society and shops opened and people went out and gigs, large scale events where people could be social again came about. That was probably the point where the ambulance service and the nurses and social care and just everyone in the NHS would have been ready to catch their breath and have a breather. And that didn't come because things weren't easy before COVID. And as COVID ended, or became more manageable and the jabs came out and people were less scared, there became a sense that people were comfortable with the NHS again, which is obviously good and healthy, because there were some people that didn't come to hospital because they were scared when they should have come for different reasons. The sheer number of jobs that seemed to be coming in at that time, there was hundreds of jobs that I'm aware of were coming in to Merseyside, and even more so in the Northwest and across the whole country at that time.
So as we were returning to normal, the NHS was just going back to an already strained system. For example, in 2019, A&E waiting times had already hit an all-time low.
You would show up and you'd speak to a colleague and it would look a bit busy. And you'd ask, at least we did, the question was, what corridor are we on? The first corridor was only 4 patients big and you could see it. And then at least in the hospital I worked in, there was the option of 4. And even during COVID, I never saw the 4th corridor, in theory, with a patient on until towards like 2022, like this year. This year was when it was arguably the busiest I saw in the Northwest, and that's through all of COVID. Part of an issue can start with social care. For example, if you have a patient in hospital who is healthy and ready to go home, has been discharged by a doctor safely, but for many reasons, mobility or care needs or whatever, they are now no longer the person they quite once were when they came into hospital. For example, they might need a hospital bed. They might need different facilities for showering or going to the toilet. They might no longer now be able to get up the stairs. So when the social care is underfunded, then obviously it can't do its job. So what happens is then people get stuck in hospital that do not longer need to be in hospital. So now you've got people in hospital beds that don't need them but can't go anywhere else. And as a result of that, the people who need a hospital bed that can't get them are stuck where they are. And those people are either stuck within A&E and can't be sent to a ward, or they're stuck on an ambulance bed ourselves. And when you're stuck in an ambulance bed, then the ambulance crews themselves are stuck. And then when the ambulance crews are stuck, then people can't get 999 ambulances. If you need an ambulance and you can't get an ambulance, something bad's going to happen.
Working within these systems can put everyone in the NHS under immense strain. Niall talked to me about how this has affected him and other colleagues within the NHS.
I was in the ambulance service for 5 years. As a result, you go to sick people. Some of it's contagious. As a result, you get sick yourself. Your managers are very understanding, but the service in itself is not very understanding, in the sense, if you're off twice in a year or 2, you're on a stage 1 sickness, which puts a stress on you. The managers are fine, but the system's in place, which doesn't allow enough days off. Never mind the mental health, which I'll get back to, but I mean the physical sicknesses. It's not your fault. There's only so much PPE you can put on and infection prevention control you can do without just picking up a sickness. There are NHS staff who worry about picking up sickness and almost being punished for it, which doesn't make sense. I like to think of myself as quite a resilient person. About 2 years into the job, and I, after a few jobs, 2 of which being paediatric arrests, being a child who needed CPR and all that kind of stuff. I, at that time, in hindsight, and I'd had a talk with a colleague who was a manager, he explained that I was showing the signs of being burnt out. But I didn't take the time off then, or at least not long enough. I think I just recovered on my actual days off from those jobs, which in hindsight wasn't the healthiest choice. But it worked and it was fine. And then a few years later, when for less upsetting reasons than those, I actually took time off work because I noticed again I was showing the signs of being burnt out, and there was guilt and I felt a bit weird, and speaking to colleagues and apologising to them, and every single person themselves either said they were fortunate enough to have not got to that place and they understood, or over all the colleagues, over all the years, all of them had experienced that at some point and had taken time off for those exact reasons. So, and thankfully work was good for that. I did mention that, people get worried when they're poorly and the problems that come with it. But work were actually very, very supportive of that. While I was off, all I ever got was contact off work, making sure I was okay, not when are you going to be back. I can only hope that's the same for my other colleagues. I can only speak for the North West Ambulance Service at that time, but I do occasionally hear stories in other ambulance services where even in that situation, due to the demand of the NHS being so busy, even when staff try to look after themselves, there is a sense of urgency to come back to work.
Niall also told me about some of the reasons he's heard from colleagues of why they are striking currently.
The NHS has always had a strange place with striking because we're almost held in a moral chokehold by the government, which is, how can you strike? People will die. But the main reason I think people are striking isn't for financial reasons. That is part of it. That is part of it. People in the NHS are not paid enough. The intelligence and responsibility, this isn't me, this is other colleagues, the intelligence, responsibility, and the hard-working hours and everything they put up with deserves more. The pay rise that kind of people are looking for is basically just in accordance with current inflation. People aren't even necessarily asking for a pay rise. They're asking for the current wages to be caught up and met with the current financial climate, basically. And then on top of that is then what people are asking for is a pay rise on what they should already be paid. For example, there's nurses and other members of the NHS that are having to use food banks. Another reason that staff in the NHS are striking isn't only for their own pay, but it's also for safer working conditions in NHS for staff and patients. Sometimes there's just not enough staff at all, and the limits feel like they're tested in terms of what we can get by with in terms of the number of people on wards, the number of people on ambulances, the number of people just throughout the NHS. It feels in every profession, every area, people are all asking for more recruitment and more staff. Not only do we need to hire staff, but a big part of it is retaining the current staff. There are people who don't want to leave, who feel that they will soon maybe not have a choice for their own personal reasons because they're not paid enough. They don't feel safe in work. They don't feel valued in work. And sadly, there are people who are having to make hard decisions to leave the NHS because they do have to look after themselves, whereas all they want to do is come to the work that they enjoy and that they worked hard for to get a qualification in and to help people. That is why everyone joins the NHS, is we genuinely do want to help people. The NHS can't function without the other people, without the porters, without the cleaners, without the maintenance staff, without the food staff. All of it, every single person in the NHS, I feel deserves a bit better. Not a miracle, but everyone just deserves a bit more support from the government, be that financially, be that morally, be that through policies that are better for everyone.